Hello, I'm Dr. Karim Kurji, York Region's Medical Officer of Health. We are experiencing a record number of cases and a very high number of outbreaks in institutional settings and a fairly high number of outbreaks in workplace and school settings. So where are our cases acquiring COVID-19 from? Well, they seem to be acquiring it from the everyday activities. For example, visits to personal service settings such as hair salons or barber shops, visit to malls, stores, a visit to medical care providers, be they doctors, dentists, chiropractors, or optometrists. And it also happens to be acquired by the therapists who come into home situations or personal service workers who come and visit their clients at home, or for that matter, home contractors who come and do some work at home. It is also acquired through large gatherings such as weddings and any place where there is close contact prolonged for a period of time. Last week, the province revised its thresholds for the Keeping Ontario Safe and Open framework. So we have now been moved into the red zone or the control zone. This does mean that there are additional restrictions. Restrictions, for example, with regard to not having more than 10 people dine indoors and not having more than 10 people in gyms. And when it comes to team sports, cancellation of these except for practices. You can find more details at our website, york.ca/COVID-19. We expect to see in about 10 to 12 days a reduction in the numbers of cases, just as we saw a reduction in the numbers of cases when we went into modified stage 2. However, we have a number of risk factors ahead of us. The first of these is the cold season. With the cold weather, people tend to cluster indoors. They tend to be close to one another. Ventilation isn't as great as it would be otherwise, and so the numbers of cases are going to increase. We are entering the flu season as well, and I urge you to get your flu shot and to maintain physical distancing. And remember, those of us who catch the flu may be more likely to catch COVID-19 too. We are also seeing a rise in cases in neighboring health units, as well as, of course, in the US and internationally. And we're not an island unto ourselves. So that, again, is a problem. We are also entering the season where we tend to buy gifts for our friends and families. So shopping is going to be a big concern, particularly crowding that occurs in stores. With Black Friday being just around the corner, please, I appeal to businesses to make sure that they ensure there's no crowding in their stores. And for every individual who goes shopping, you have to take personal responsibility to extract yourselves from places where you see crowding occur. That having been said, we have to get across this winter safely. There is hope around the corner with a number of effective vaccines coming onto the market. We now have to go back to what we used to practice in the early days of the lockdown. So stay home wherever possible. Only go out for essential visits, and you'll remember those essential visits were visits to your physician, getting your medications, getting groceries maybe once a week. Make sure that you are able to do much of your shopping online, if that's possible, and do not socialize with members outside your household as much as possible. And then we have our usual advice that we have to follow, which is cough and sneeze etiquette, staying at home if you are ill, ensuring physical distancing of 2 meters or more, and wearing masks where indoors and where it's legally required and where physical distancing may be an issue. and downloading the COVID-19 app if you've not already done so, getting your flu shot, and of course seeking testing at the assessment centers in York Region should you have any symptoms of COVID-19. We have no choice in this. There aren't many interventions available, so we have to use these basic measures. By doing so, we should be able to keep ourselves, our friends and families, and our communities safe. So please stay vigilant and stay safe. Thank you.